Today, I want to talk about 5 high-impact abstracts or clinical trials for GI oncology presented at the 2025 ASCO Annual Meeting. Number 5, going to start with Destiny Gastric 04. Now, this is a study that investigated anti-HER2 therapy versus standard of care ramucirumab and paclitaxel in the second-line setting for patients with gastric or gastroesophageal junction cancer. This was about 500 patients that were randomized to receive either trastuzumab deruxtecan or ram-tax, the standard-line second-line therapy, in patients with HER2-positive gastric or gastroesophageal junction cancer. In this study, overall survival in the trastuzumab deruxtecan arm was larger or longer than the ram-tax arm, 14.7 months versus 11.4 months in the ram-tax arm. The progression-free survival was also higher in the trastuzumab deruxtecan arm. And the reason why this trial is so impactful is because this shows us that in the second-line setting, these patients that are HER2 positive with gastric or GEJ adenocarcinomas should receive trastuzumab deruxtecan versus standard of care chemotherapy and anti-VEGF therapy. Number 4, the challenge study. So this is a study that investigated exercise in patients that have had resected colon cancer and had completed their adjuvant therapy. So they randomized roughly 900 patients to receive either a structured exercise program compared to the other arm, which is essentially just receiving health education materials alone. In the patients that had a structured exercise program, the 5-year disease-free survival was 80% in the exercise group and 74% in the health education group. This is an impact of exercise that we see that is, in some cases, higher than chemotherapy. And the reason why this abstract is so important and this clinical trial is so important is that, number 1, shows the true importance of exercise in the post-operative period for patients with resected colon cancer. And then number 2, it's really important to understand that this really just means about 45 minutes of kind of high speed walking or essentially any walking, roughly about 4 or 5 times over the course of the week. So we're not asking for a ton of exercise here, but it does show a significant disease-free survival benefit. Number 3, Matterhorn. So can we add immunotherapy to standard of care chemotherapy in patients with perioperative gastric or GEJ adenocarcinomas? This was a study that randomized over 900 patients to receive flat chemotherapy with durvalumab versus flat chemotherapy without anything else. And when we look at the disease-free survival, it was not reached in the flat and durvalumab arm, and it was 32.8 months in the flat arm. The event-free survival at 2 years or 24 months was 67% in the durvalumab arm and 58.5% in the flat arm. And what this tells us that there is a new standard of care treatment for perioperative gastric or GEJ cancers, and that is flat in combination with durvalumab in eligible patients. Number 2, BREAKWATER. Can we add targeted therapy to frontline chemotherapy in patients with BRAF V600E mutated colorectal cancer? We know that this is a population that has a very poor overall survival with standard therapies. So BREAKWATER looked at FOLFOX in combination with encorafenib and cetuximab versus investigators' choice chemotherapy. And when the investigators looked at the overall survival difference in patients receiving FOLFOX, encorafenib, and cetuximab in the frontline setting, the overall survival was 30 months, and that was compared to just 15 months in the standard of care arm. The progression-free survival was also a lot longer, 12.8 months versus 7.1 months. And this really shows us that in our patients with BRAF V600E mutated metastatic colorectal cancer, the new standard of care should be FOLFOX in combination with encorafenib and cetuximab. You essentially get a doubling in overall survival. And then finally, number 1, Atomic. Can we add immunotherapy to patients with stage 3 resected MSI high colon cancer? So Atomic was a study that looked at FOLFOX versus FOLFOX in combination with atezolizumab, where the atezolizumab, the PD-L1 inhibitor, was given for essentially a year. This study randomized roughly 700 patients to FOLFOX versus FOLFOX and atezolizumab, and the 3-year disease-free survival rate in the FOLFOX and atezo arm was 86%, and that was compared to 76% in the FOLFOX alone arm. And what this means is that this is a practice-changing study that tells us that in patients with MSI high stage 3 resected colon cancer, if these patients are eligible for immunotherapy, they should receive FOLFOX in combination with atezolizumab. We also know that there are some neoadjuvant options in high-risk disease as well, but the ATOMIC study is a game-changing clinical trial.